Go ahead.
Great. Thanks, Sans. I was just about to say, just as a reminder, we'll be recording tonight's meeting. So thank you for that. Also, an option to mute your phone. You can use *6 to mute and unmute your phone if you choose to, or you can use your own phone to mute. And so why don't we get started? I'd like to call the meeting to order at 7:34. Sans, do we need to take roll call again?
Yeah, just for Andrea's purpose, we should. Andrea, just to confirm who you have?
Sure. We have Dr. Henry Yoon, Sally Colony, Christine Vitale, Mark Hotchkiss, and we have Sans Cleary, Jill Mitchell, and myself, Andrea Flynn.
Is there anyone else on the call? Hearing none, go ahead, Henry.
Great, fantastic. So hopefully everyone had a chance to take a look at the minutes from our June meeting. Had a chance to read through them. Does anyone have any comments or questions or corrections they'd like to propose? Great. Well, if there aren't any, can I get a motion to approve the minutes as written?
I'll make a motion. This is Sally.
Thank you, Sally. Can I get a second, please?
I'll second. This is Mark.
Thank you, Mark. All right. All those in favor? Well, maybe it's just easier to say anyone oppose or abstain? I think, Mark, you'll have to abstain, correct? I don't believe you were at the meeting, last meeting?
Oh, no, I was not. That's correct.
All right. So we have one abstention. All right. Fantastic. Thank you. Why don't we move on to our Director of Health report?
Sure. So I'll start with just some COVID statistics of what's going on. Fairfield continues to fare very well. We're remaining relatively level. We've been at 657 cases. We've actually lost a few, so as they're going over time, they're correcting addresses and finding that people live in other towns, so we're losing a few cases, and then we're kind of gaining a few here and there. This past week, we've just had a handful of cases coming in. The last 2 weeks, I think we've had something like 6 cases, maybe 7. I didn't get an update today. So we're getting very, very few cases coming in, and in the last 30 days, I think it is, we had one death due to COVID. Good news in Fairfield. Good news in Fairfield County. The hospitalization rate continues to decline. I think we have 27 people currently in all of Fairfield County that are hospitalized due to COVID, and that is a decrease from Friday's numbers. For Connecticut, some of the really good statistics are that the positivity rate for testing is currently 0.6. So 0.6% are testing positive for of all those tested. That is down from a high of 39% of all samples being positive at the peak. What's going on in terms of the reproductive rate, that is the number of people infected by one case. It's good when the number is below 1, and increasingly worse as it goes above 1. At the peak, we had nearly a 2.0 reproductive rate. Right now, Connecticut is at 0.9, so we're still under 1, which is good. The concern is that over the last few months, we've gone from a low of 0.74 and increased to a high of this 0.9. So we're on this very gradual increase. One of the predictive models at COVID Act Now has us above 1 already. And we are one of 7 states in the country that have this rate below 1. We're the second lowest in the country at this point. But most of the other states are above 1. Some are trending downward. Some are trending upward. We are gradually trending upward, which isn't good. But all around us, Rhode Island, Massachusetts, Maine, New York, New Jersey, Vermont, New Hampshire, not Maine, excuse me, but Mass, New York, New Jersey, Vermont, New Hampshire are all gradually increasing this reproductive rate over the last month or so. So those are some of the things that aren't so great in Connecticut, what's going on. In addition, as most of you are aware, it's throughout the country, many states are seeing widespread community transmission occurring, with thousands of new cases being seen and hundreds of deaths being seen each day. So it's not a good sign. Right now, our area, Connecticut, and our area still tends to be low, but the trend in the country is not good at this point. So that's kind of the update of where we are. Some of the focal points of what we've been working on lately over this past month has been looking at our contact tracing. And so the state implemented a new contact tracing system on May 20th. And as with any new big systems, it was took a little learning curve to get going on it. And for us, as well as many other health departments, right now all Connecticut health departments are on the system and using it. In that time, we've dealt with 143 cases reported through that system. Many of those cases that didn't require intervention on our part, either that the individual resided in a long-term care facility, and so they would be responsible for doing the case management on that. We had 6 individuals that were unreachable. We tried all methods. What we're doing is basically doing a variety of searches if we don't have contact information. Sometimes the cases are provided without contact information to like a home number or so whatever they give us, we do various internet searches, social media searches, try to obtain where they any type of means to contact them, and then if we cannot make contact, if we find a good number, we'll call it 3 times, and if they over 3 days, and if we can't reach them, we'll send a letter. So we've only had 6 of those that are unreachable. We've had three individuals sort of opt out, saying, and it's a voluntary system, so we've had a few people opt out of the electronic monitoring that's available in the system. 48 of the people that have had their monitoring concluded. We're currently monitoring 3, and we're in the process of attempting to monitor 1, and 1 is just a newly assigned case that we haven't made contact with yet. And 81 of those cases that came in was either, as I said, monitored. We didn't attempt monitoring. Either they resided in a nursing home, or what's happening, and this is, we've done multiple conference calls with the state about this, our staff has, that the reports are coming in delayed. Testing for a lot of facilities is being delayed now, so we're not getting the reports until sometimes well after their period of monitoring is applicable, and so we're not, there's no logic in us monitoring those individuals. And in some cases, by the time we get it within the window, but they don't call us back, or we're unable to make contact with them during that period. And one of the things that statewide they're facing is that people's refusal to provide names and telephone numbers of their contacts. So people just don't want to do that. They will report to us that that they've reached out to them, they've made contact. They'll take our name and number and give them to them for them to contact us if they desire. But there's a lot of refusal on naming individuals that they came in contact with, and it's not unique to us. That's going on with all the contact tracers throughout the state. So that's kind of been some of the stats and some of the focus of some of our efforts that are unique this month. We've had myself and our leadership team have had a variety of different meetings. Myself and the emergency manager, fire chief, met with the clergy again. We've had several planning team meetings. So we have another committee that does planning related to decisions to be made within the town. And we talk about a variety of things at those planning meetings. We've had talk about the beach openings and events, different events that ask the town if they can use town property. So we've made every week there's a variety of decisions that group makes decisions upon, and then conveys that information back to those requesting it and to the departments that are involved. One of those meetings we did recently on the 10th meet with the Board of Ed leadership to review the general concept of the state's guidance document to reopen the schools and briefly discuss some of the work they're doing there. And they're very busy with the numerous details related to that. As Jill can share about in her report, Jill's very, very active in being a part of that group. But the planning committee, which the first select woman was part of that meeting, and the chief of staff, the emergency manager, myself, several others, will once they've actually finished their initial plan that they submit to the state by the July 24th, then we'll have another meeting with them to kind of go over how the town can be of assistance in implementing any of that plan. So that's we should have another meeting on that sometime later. We have had several command meetings as well with the command team of the town. We've continued our phone conferences. We've had a couple meetings to review the election plan. So there's a component of the election plans for the presidential primary and then the presidential election that the state is requiring to be reviewed by the health director and the first select woman. So we've had two meetings with both registrars and voters to move forward on that plan. We've also had a couple meetings with Human Resources and DPW on a variety of COVID-related issues. And in addition, we had another meeting to talk about the impacts of the travel advisory on town employees and different departments. And so we continue to work on that, and every week that list changes, and so we try to provide guidance to HR in terms of how to interpret that and some of the nuances of that. I did participate in the State Department of Education webinar about the school reopening plan. So that was very informative. A lot of good questions there. Aside from all that predominantly COVID-related activity, we did have several meetings this month where we're pursuing a new permitting software database system that will involve several departments in the town. That we did sit through three-hour long product demos from the three companies that were submitted bid proposals, and had two deliberation meetings to come up with a final choice for the lead vendor that will be submitting to purchasing. We did, in terms of fill pile activity, we are continuing to work with the Connecticut Department of Energy and Environmental Protection to move forward with the remediation. It's a long process of back and forth with our attorney that we've hired, environmental attorney that we've hired for the town, and DEP to kind of work out which projects we can move ahead on more quickly. And so we're continuing to work on that. Related to that, we did we were asked by the Department of Public Works to provide clarity to the Public Works employees that worked with the materials from the fill pile over the period that the fill pile was operational, and those employees that were working adjacent to the fill pile to make a determination about if there was any health risks that they may face. And so the town HR, through consultation with the Connecticut Department of Public Health, hired a Yale Occupational Health program headed by Dr. Redlick. And Dr. Redlick reviewed all the testing data that town had available, including pre-fill pile use, the time the fill pile was operational, the time after when they were doing the remediation for the area that was contaminated, to the construction of the berm and both soil testing and air testing, and then even most recently to some of the other materials that were found in there. And the report in general found that the levels were well below the levels were well below what anyone was likely to experience any health effects, to the tune of, I think the lowest number was 7,300 times below, up until 11 million times below, where they felt there was any risk of health effects. These are below PELs, or permissible exposure limits. So we received that initial draft of the report, had a meeting to review it. We had a conference call with Dr. Redlick and our partners to discuss some aspects of it, trying to understand that, and a couple things that we picked up that didn't seem consistent. And then Dr. Redlick finalized the report, and then just this past week, they brought in all the public works employees to the auditorium at Ludlow, and had Dr. Redlick present the report and be available to ask any questions. And so I've heard from a few public works employees that it was that she did a very good job, and they were impressed with her. And and as with any large group, there's still some outstanding questions that I believe they are working through. And there's an offer that any employees that wished could individually consult with Yale Occupational Health and Dr. Redlick and her partners for additional testing if desired, for a consultation about anything they may be experiencing where they wanted to do it. on a more private basis. And so that is where we are with that particular process. And then we additionally had a meeting to initially discuss some adjustments to our shelter planning for the hurricane season, and based on some CDC guidance for disaster sheltering. So looking at some accommodations we have to make to our sheltering plan, and then the emergency management team, myself, and the CERT team, the Community Emergency Response team, leadership toward the Fairfield Ludlow High School level where we typically do our sheltering, to look at some accommodations, particularly creating additional isolation areas for if families showed up that were moderately ill, or for families that may have become ill during the time that they were staying at the shelter. So that was just some adjustments to the screening process upon entry, to look at the physical spaces and make some determinations there. And I'll wrap it up with, we continue our water sampling each week. We did have 1 week where we did have significant amounts of rain, particularly in the northern part of town, which did result in a 2-day closure of the swimming area at Lake Mohegan. And so, but other than that, the levels found, and even the levels, I was kind of surprised because it was creeping to the rainfall level where we would have closed them for 3 days, but it wasn't quite there yet. And in recent years, Lake Mohegan water test results have been somewhat unpredictable with rain at times. Levels were unexpected and are unexpectedly higher than we thought. And we were pleasantly surprised on Monday when Monday's result came in, and the lake had recovered and was back to acceptable levels at the on the day that it opened. And so it's going back to being a little bit more predictable, hopefully. But it's really, as we're learning, as more and more technology becomes available and more rain gauges are available throughout the town, even private rain gauges that they're all connected through Weather Underground. We can see how variable rainfall amounts are from just a few hundred yards from each other. And so it could be just that the lake actually experienced far less rain that was shown on some of the rain gauges in the area. Could be one of the factors. But even then, it was good to see that the lake recovered and was back to normal levels, normal swim levels on Monday. And so with that, I'll wrap it up. Unless there are any questions about any aspects of my report. Oh, and I did want to share, just for a perspective, going back to COVID. Today we just got notice that Los Angeles County and 29 other counties in California have taken a big step towards starting to close down again, and that fitness centers, places of worship, nail and hair salons, indoor malls were all on a list to close. Their positivity rate for testing has risen to 7.7%. Their ICU beds in a county of 11 million people in LA, there's just 113 ICU
You
beds.
have 10 seconds.
Okay, can everybody still hear me?
Yeah. What does that mean then?
I do not know. I do not know, so we'll give it a try. If we have to call back, we will. I did not think there's any time limit on this, but so I'll keep talking unless
Okay.
and then I'll ask at the end of this where I'm still here. People are still on there. If not, we'll call back. But essentially, that the LA School District announced that in the fall there wouldn't be in-person instruction beginning this school year. which is some big decisions, and I think you're going to start seeing that in a lot of other states. While Connecticut, we're nowhere near that decision point yet, but it's just indicative of what other states are seeing. So with that, I'll ask. It sounds like people are still there, so we'll keep moving on. Any questions?
We're still here.
All right,
Okay.
great.
Thank you. I didn't bore you all to sleep, I guess.
No, it's good.
Thank you. I was just about to say thank you, Sands. So if no one has any questions, why don't we move to our Assistant Director for Public Health Nursing report.
Hi, Jill here. I got dumped out of the call about 2 minutes ago, but I'm back. I don't know if anybody else did. I just wanted to bring you up on some of the things that hello?
Yep, we're here, Joe. Go ahead.
Okay. That Public Health Nursing Office has been involved with. Our biggest thing so far since our last meeting was opening up the summer services program for a few select special ed students over at the ECC and at FITS. And it was a lot of work, and I just can't believe that we actually got it up and running. It's a week ago already that it's been in place. We did it all according to the summer school rules that were put out by the state earlier in June. It involved writing a series of procedures and protocols on screening, illness monitoring, notification of illness. And all of that is in place, and I'm glad that it is, because I think it'll give us some idea of how to go forward with those kinds of mandates that we have to return to the state, among so many others, but at least in terms of what the health department will be contributing. Since then, I'm also working on advising on reopening. And actually, Dr. Yoon and I were meeting this afternoon for quite some time with members of the Board of Ed and Central Office, just adapting the state's plan, which is called Adapt, Advance, and Achieve, Connecticut's plan to learn and grow together. I believe that's it. And we're working with some of the operations people, notably Angela's Papa George, and some other representatives, various stakeholders in the process, and just working on that. And that's going pretty well. We have to get everything back to the state, the final plan back to the state by July 24th. So there's just a series of meetings. It's like every other day. I think the executive board is meeting every day. Just a lot to do, but I think everyone is really looking forward to it, and with the numbers, as Sands described earlier, in terms of our infection rate and the ICU headroom and the contact tracing, I'm looking forward to getting the schools open. It'll be a challenge, and I don't mean to minimize that, but I'm looking forward to it. The other thing that came up with the reopening of school was a change in a couple of the mandates. If any of you have children, I'm sure you know that you have to get physicals in, health assessments, and immunizations. The immunizations the state has really stood very firm on. They do want students to be fully immunized on the first day of school. We have surveyed many of the pediatric practices in town. Are you guys still with me?
Yes, we are.
Yes.
Oh.
Yeah.
I don't like these telephone meetings. I like to see people. The immunization mandates are staying firm. Everybody has to be fully immunized. Some of the pediatric practices in town feel that they will be able to do it. A couple of others, not so much. So what the nurses are doing currently is calling up people who we know are delinquent, that we can tell from the Infinite Campus program, delinquent in their immunizations and just offering students and parents to be vaccinated down at the health office. And we've actually gotten a pretty good response on that for the 7th graders who need a Tdap and their meningococcal vaccine. And we're going to be working on doing more of an outreach to the kindergarten students as well. The other thing are the health assessment mandates, and that will be, I think, voted on. It must be on the agenda, Christine, you would know, tomorrow for the Board of Ed meeting. And instead of having physicals due before the child can enter school in 7th grade and in 10th grade, we're giving them what amounts to a 3-month extension or 4-month extension to get it in by December 31st. And most of the practices around town, again, support that. They feel that they can get most feel that they can get their vaccines done. Getting the physicals done is a bit more of a challenge. And the other part to that is that kindergarten students, they would normally need a PE, a physical, from August 2019. We're kind of extending that back to August 2018 with the understanding that they will get one as soon as it's available, a slot with, their home pediatrician. And the other item is sports physicals, and they usually have a 13-month shelf life. CIAC, the Connecticut Interscholastic Athletic Conference, has recommended extending that to 15 months, so adding 2 months on to whatever existing physicals that are valid right now. So I think that'll help. I mean, I think that having physicals for student athletes is an important goal. A 2-month extension, though, I think is worth it. Let's see. The other thing I have are my staffing needs. We have 4 full-time openings, which is, in other years, would make me gulp, but somehow it kind of pales in comparison this year. But we're going to be able to fill those. I've also, I don't know if you know it, but our part-time staff, the overwhelming majority of our part-time staff was laid off back in April. And with plans for all of these schools reopening, we need them back in their positions, particularly in the private schools where most of them were working. And I've asked HR to do a recall for them to get them back and back on the payroll for August. I haven't heard much from HR, but we'll follow up with that as well. And that is about it for me.
Great, thank you, Jill. Does anyone have any questions?
Jill, I just thought I would. Are you going to be needing to bring a policy change before the board prior to the start of school?
Well, Sam, that would be difficult because August we typically don't meet. But if we could do a phone call like this, once it's approved by the Board of Ed tomorrow night, and I assume that it will be approved by the Board of Ed, then we can, I'd like to call an emergency meeting if that's the case in August.
Okay. Yeah.
Or sooner.
I know we had talked about that, but I would bring it up just for the board to consider that we may need to have, which we don't typically have, an August meeting. We may need to schedule an August meeting to have a special meeting for that if that's agreeable.
Great. So, Jill, I just had a question. This is Henry.
Okay.
So, did I understand you correctly that in Fairfield we're going to extend the date in which a physical is being accepted?
That's right.
So my question is this, and I completely understand the logic behind it and really prioritizing vaccinations, which I think is the right thing to do. But I know in most cases, local municipalities can be more restrictive or strict than state guidelines. But my understanding is we can't be any looser. So can we do that? Can we extend accepting the dates in which we will take physicals if the state mandates that it's by a particular time?
Well, actually, it was the guidance from the state that suggested that local school boards act so as not to present a barrier to children getting back into the classroom, that this particular mandate should not be the reason why students are kept out. And quite frankly, Henry, I have to support that.
Yeah, no, I'm in agreement with that too. I just want to make sure that we don't run into any issues. I mean, again, there's guidance, and an executive order, but if we're functioning contrary to currently established state regulations, are we going to run into issues? So I just bring that up.
No, I don't.
I mean, I agree.
I really don't think so. Just because of the way that it's worded, and it was worded, the two letters that we got from the I guess it's the Commissioner of Education. I'll grab them and see if I can get the exact wording. But it was very clear that the vaccinations they're not going to budge on, but that they're not changing their rules for health assessments, but that it would be up to the individual boards of education to make that accommodation for them.
And Jill, if I'm correct, they specifically gave the example of, for example, boards may choose to extend the dates for physicals to be submitted until the end of December, right?
They didn't do that. I have to tell you, Danbury is leaving it open-ended. They're like, whenever you can get it in, get it in. Greenwich is doing what we're doing. I don't know what other districts are doing, but I believe it is similar.
But didn't the guidance document provide some specific examples of it that local boards of ed could extend the date into the fall?
Yeah, hold on. I have the language right here. Boards are permitted to deny attendance to a child who fails to obtain the required health assessments. However, during the 2021 school year, given the unavailability of appointments due to the pandemic, boards are encouraged to prioritize keeping students in school where possible. Being present in the classroom is especially important this year due to the cancellation of classes in the spring. Where appropriate, boards should work with parents and guardians to have an appointment scheduled as soon as possible rather than deny attendance. Boards should review their internal policies, consult with board counsel regarding the flexibility, and go from there.
Right. So I think we're all in agreement. I mean, I don't want to speak for anyone else, but I think we're in agreement that the spirit in which that guidance is being provided is a good one. And, I, for one, would certainly support that. But it even sort of hedges itself when it talks about the fact that, that the boards, that they suggest that perhaps they should consult with their the board's legal counsel. So that would be my recommendation. But again, I think in terms of the spirit of what that guidance is offering, I would support. So again, just something to think about. That's outside of our purview in terms of the Board of Health, but being that we have Board of Education representatives on this board, I just thought I'd bring it up for discussion.
I'm just going to jump in. Christine Vitale. The Board of Ed also received that guidance from CABE, the Connecticut Association of Boards of Education, that we should be reviewing this policy, the immunizations. The state was not budging on, but if there could be flexibility in extending the deadline for physicals, that we should take that action. Appreciating that it's just hard for parents to get appointments, so we'll be taking action tomorrow at our Board of Ed meeting.
Great. Fantastic.
Thanks.
All right. Any other questions or comments?
I met with the policy committee last week, and certainly had their questions for me. And I think that what has to happen, Christine, you probably know more about this than I do, is that Mike Cummings, the superintendent, needs to change the regulations, and he has the ability to do so. And then the policy
administrative
for,
The administrative regulations need to be changed for staff, and the superintendent has the ability to do that.
Yeah.
Great. Well, any other questions or comments? All right. Fantastic. Thank you, Jill.
All righty.
Let's move on to communications.
I have none.
I thought we had one, Sands.
Refresh my memory, Henry. I'm drawing a blank.
Had an email that was sent to you in regards to representations by board members. So I'll bring that up.
Okay. Regarding meetings?
This is Sally. I'm sure I know what that's about, but okay.
Yes. So, let me just share again. So Sands was contacted by a member of the public with some concerns about, some comments that were made on social media. And unless it's absolutely necessary, and I don't believe it to be the case or necessary, I think what's important is that, and what I wanted to do and what I communicated with this member, a member of the public, was just to remind the board members that, obviously they represent the Board of Health here in the town of Fairfield. Again, and I'm sort of preaching to the choir because many, if not all of you, are well aware of this, that we should be cognizant about, comments we make in public and on social media that borders somewhere between, personal opinion and representations of us as a board, and not as representations of the town. And so, again, I'm not saying anything that people aren't aware of, but
do you mind if can I speak to that, if that's okay?
Oh, absolutely.
Yeah, okay. I just wanted to, be able to say something so people understand the context of it. Sure. Which is basically that what it was in response to. Well, first of all, I want to say that this was on a Moms forum, just so people know. Secondly, nowhere on the post did I invoke the Board of Health piece at all. So somebody in a comment chose to later, and this is somebody who was also, just so you know, under a false Facebook profile under the name of TJ Binford. It was like a fake profile that had no mutual friends in town, etc. And well, since you are on the Board of Health and started targeting, but under a fake profile. Okay, so there was that one person who didn't even choose to reveal who he or she was, and is the one who brought up that I was on the Board of Health. Nowhere in it did I mention that at all. And what this was in response to is you've had a number of people who have been doing a lot of public shaming on that forum. Are you on that forum, Dr. Yoon or Sands?
No,
I'm
okay,
not.
So what
nor have I seen, just to let you know, nor have I seen the particular comments or
right.
the content. And
yeah,
again,
so basically there've been there've been like a number of posts, or there had been at that time, that really are like shaming types of posts, and just like if somebody saw a few teenagers together at a park, for example, it would be like a shaming thing to these parents and stuff like that. And this was right, after the opening of phase 2. So we're talking about in June 20th. It was around that time. And I said something to the point of, listen, I think we need to stop doing this public shaming. Nowhere in it did I say anything like stop wearing masks. It was something like we have more freedom in some of the parameters. Different people are going to feel comfortable, some people going out into public places within using certain protocols, and some people are choosing to completely stay at home, but also it's like I don't want somebody to be giving me hassle if they see me out at a outdoor restaurant having food or drink, because that's within the parameters. So it was a little bit abrasive, I will admit to that, to the sense that it was confronting all of these, that's why we have people who are being called Karens, right? Because they're just trying to force kind of control on other people. So I just want to point it out that I did not invoke like the Board of Health piece at all. I said to me like I worked in health care, so it was not referring to any sort of representation of the Board of Health. So, and nowhere in it did I say to do anything that was outside of the protocols. And just one other sideline is there was a physician, Dr. Lipkind, Heather Lipkind, who reached out to me in a private message, and she wanted to share with me some of the research and things that she had experienced. And so we did a social distance walk on the beach together and had a conversation, and she talked about her perspective. I talked about things I'm seeing in people's homes and home health care and concerns. So it ended up being productive, I think. But I just wanted to point that out, that that's where it stemmed from. So.
Well,
I appreciate
you
you
for
sharing that, Sally. Yeah. Yeah.
Go ahead, Sam.
I appreciate you sharing that. Again, and I hope you know that, when the only reason we bring it up is somebody brought it to the attention of the Board of Health. The email said, to the Board of Health, and so, and you can tell by my response that, I didn't really. I remember now that Henry's brought about it that we had this conversation and a few emails back and forth and talked about it. But like that, it wasn't a big issue to us. It's just one of those things.
And listen, I'm a straightforward and opinionated person about certain things. I'm aware of that. It gets me in trouble sometimes, and I think the fact that I did run a political campaign in the past, then you have certain people who target me. I'm just going to be, and those people are often targeted. If they were a more neutral person, I don't think it would have been as much of an issue. But I said, listen, I will I'll keep that in mind in future, and perhaps change, consider my wording or something if it seemed too provocative. So anyway, that's just my But thank you.
Yeah.
Thank you.
No, and again, and that's why I really, my comments are really directed at the board in its entirety, because it's a lesson we should all be aware of.
Right, and I think I think that some people, just to interject one more time, is the other thing that's also very irritating is when you have a lot of people who have the privilege to stay home all the time because of their jobs or because their husband or their wife is the one who's the breadwinner and they don't have to. These are the same moms who are complaining about their Instacart deliveries being wrong and being late.
I'm going to interject.
Wait, I want to finish my thought on that. And
no, I really. This is a public meeting, and I think that we really need to be very careful how we're speaking about members of the public during a public meeting.
Okay.
I mean, I really don't think that an individual social media behavior and how she feels about other people's social media behavior is really proper contact for a public meeting.
Okay, that's fine. I was just trying to explain.
Vitaly, just for the record. Thank you.
Okay. I'm just explaining the context of like why I felt like I wanted to respond. So in response to Christine, that it just came up, I feel like it's my right to be able to defend why I brought something up and that I have worked throughout the entire pandemic since March, and I've needed to go to patients' homes and continue to serve people and work throughout the entire, situation. So, yes, I am going to be a little defensive on that.
Well,
okay.
for this meeting, no one knew I did not know what this letter said, so I feel somewhat at a disadvantage, and it just seems like we've kind of gotten off course, and I just want to be sensitive to the other members of the public that possibly might be affected by this conversation.
And Christine, I appreciate it. Again, your point is well taken. And so if I could just sort of wrap this up again with just the idea that, again, I know I'm preaching to the choir that we just need to be very cognizant as members of this board, where personal opinion ends and representations of this board sort of begin. And again, we'll just leave it at that unless anyone else has any comments about it. But I think the overarching message is the one that I wanted to sort of portray. So, but thank you for your thoughts. Thank you for your comments.
Okay. Thank you.
And if there's nothing else, Sam, can we move on to old business?
Yeah, I have no old business.
Great. New business.
And just the only thing I wanted to bring up under new business is the possibility of having a special meeting in August that to approve those changes to any health department nursing guidance documents related to the physical. So there might be a possibility of an additional meeting in August, and we would just notice that.
Right, and I think that's very reasonable for that reason, and the fact that, recognizing that school is coming up, I'm sure people are going to be very interested in finding out what's going on. I suspect, and I probably won't be too off, that, things will have changed or perhaps not considerably, but, being a dynamic situation, things will have changed by then. And so an update, I think, would be very reasonable. Sans, do we have to get a motion to add an August meeting? Is that how we would do this? Or do we just do it by consensus?
I don't think it would hurt. I don't know the practice on that. I think that a board can call a special meeting as long as they notice it properly through the town clerk. But again, if there would be a motion to hold a meeting in August for an update and to approve any policies changes that may be necessary, that'd be appreciated.
Great. And do we have
to tell you,
come up with a specific date?
You don't have to wait until August. It could probably be in the next 2 weeks because they're going to vote on it tomorrow, if that helps anyone's schedule.
Well, so there's a balance between, that there may be some, as Henry alluded to, some updates that might be, there may be more issues that we have to consider if we wait a little longer.
Good point.
Yeah, this is Christine again. I was going to ask the same thing. I watched the governor's press conference this afternoon, and it made it sound like some guidance from the State Department of Health might be forthcoming the beginning of August. I don't know if you've heard anything, Sans, about that. Maybe it might make sense just to wait until August to meet if that guidance is coming.
I know one of the big things that everybody's asking related to the school reopening plan is the metrics of what are the things to consider regarding low, medium, and high situations on page 24 of the report, that report, where they talk about when they would transition from full in-person school to partial in-person and remote learning to full remote learning. So that's maybe what they're alluding to. That's kind of we've asked them in public meetings. I asked them on Friday at the Department of Public Health, and the Deputy Commissioner of the State Department of Education was on, and her response was, we're working on it. We know everybody wants page 24 clarified, and so we're working on it, and as soon as we can, we'll get it out. So it's likely something related to that.
So if we stay along the pattern where we do second Monday of the month, that would be August 10th.
Okay.
So just to be complete, if I can get a motion to call a special meeting or an additional meeting of the Board of Health on August 10th, I would appreciate it.
This is Christine. I'll make that motion.
Thank you. Can I get a second, please?
Mrs. Mark.
This is Sally. I'll second. Yeah.
Okay, great. Thank you. Any objections or abstentions? All right, fantastic. Thank you. The only other comment that I had really isn't new business, but it's just along the idea. I've spoken with SANS to see if there are any other modalities that we could use to meet in addition to the phone, knowing that in-person meetings aren't yet allowed unless it's absolutely necessary, to see if there was some sort of, to Jill's point, some sort of video conferencing technology that we might be able to leverage so that we could see each other. I think it makes for a more interactive type of meeting, and I think SANS said that he was going to look into it and see if that's somewhat of an option. I'd advocate for that as an option as well, either video conference or telephone. So I think SANS will continue to do some homework, and if that's an option, we'll offer that up for the August meeting.
Great. Thank you.
Great.
All right. Great. Any other new business? Anything anyone else would like to comment? All right. Fantastic.
Can I just ask?
Yeah.
Can I ask a question? One question. I don't know if this is the right spot for it, but I have noticed there have been a lot of additional concerns, and I'm curious your perspective on that from Board of Health, but about the major influx to the beaches in the beach area, just with all the, of course, there's the addition of the extra cars, but there's been people parking everywhere. I saw a lot of photos, and it was really, really crowded and people parking from out of state. So I'm just wondering if anybody from Board of Health is working with Anthony on that too. I don't know if they need to pull back or what.
James, are you aware of anything?
Ben?
Hi, folks. I'm sorry. I just dropped out and had to call back in, but I believe I heard the entire point of just an influx into the beach area. So some of the things that have happened, the planning committee has reduced the parking available at Jennings back from around 900 down to 500. They've kept the limits on out of town day passes to, I believe, 200. In addition, they petitioned the police commission to increase the fees, the legal parking fees, from, I believe it was $80 to $200. So those are some of the strategies that the planning committee has put in place to kind of address that situation, because we're still getting a lot of and one last thing, they've asked the owner of the Bob's parking lot if the town can put the variable message sign there that basically indicates that cars will be towed, and that they've actually put a special police officer there on the weekends, and that's fine. I'm not sure how long that's going to stay there, but they're trying to discourage people from parking there.
Yeah, my friend one of our friends owns the house next to Veterans Park, and he took a picture yesterday of the entire lot was packed and no games going on at all. It was all out-of-state cars. And then and there was a new page made in the beach area that somebody added me to it. I'm not on the beach area, but I happened to see the pictures. And people, like, even in, I know it's not really private, but you can be on that up to the tide line. But there were concerns about, people with young kids, families all along there, and there's no lifeguards, so it just seemed like a lot of new concerns that people were feeling the last 24 to 48 hours. Just wanted to throw it out there and get it on the radar.
Sally, I didn't quite hear the part about the lifeguards at the end. You broke up.
I'm sorry. So the because people are even going down, let's say, Pine Creek and parking all along there, then they're walking into all the areas and, cutting through between houses and walking into the parts that are usually private beach, but, you can technically be between the water and the tide line. And I know there's those other legal issues of, I think Greenwich was sued a number of years ago for not allowing access. But there's been a lot of families cited then in that typically private area. And so I think that they were expressing concerns as well about, there's no lifeguards at all in a lot of those areas. So anyway, just so it's on people's radar, not just, it's certainly like health and safety, but the crowding. People were saying they've never seen the beaches this crowded at all. And then there were a lot of residents who were turned away because they couldn't get parking anywhere because of the 100 resident day passes. And then all the people who are walking in from so many other places are Ubering in. So I don't know.
Well, again, this is a situation, as it's been explained to me, that's not unique to COVID. That this is an ongoing situation of people parking illegally and people taking Ubers from whether it be the train station parking lot or from Bob's. So that's an ongoing thing. So they've tried a couple new strategies this year.
Yeah.
I guess I was unaware that they had what's called Israeli barriers blocking Veterans Park.
They had those there for a while because even when I picked up my son, there was nowhere to park.
And they were there as recent as last week. I saw them there. But
they were. And then the baseball started back up, so they had to open it. And anyway, it's there were just a lot of people in the beach area. And again, like I haven't been much of an avid beach goer in my life, so they said it's busier. It's been way busier than it's ever been for all these people who have lived there for years. So just saying. And the pictures are like, wow, crowding.
Yeah, and just to say that, at every planning meeting, the beaches are at the top of the list to talk about the issues, to talk about are people properly spacing, what adjustments need to be made. And so each week they're trying new things. So I'll leave it at that.
Yep.
Thanks, Ellie.
Thank you. Yep.
Great. Thank you. Well, if there's nothing else, can I get a motion to adjourn? All right. Well, we'll go ahead and adjourn the meeting now.
Motion. Motion to adjourn.
Great. Thank you, everyone.
Thank you. Bye.
Good night.
Bye-bye.
Good night.
Bye.